Guest number 36,837 from Henry Ford Jackson Hospital, VP of Population Health, Dr. Courtland Keteyian. Good afternoon.
Thank you. Congratulations.
Well, thanks.
Yeah.
Thanks for being here. I think you've been on one of our...
I think I was here last year for the 22nd
Were you really?
anniversary, yeah.
Wow, it looks like we got a new tradition going.
That's right.
Yeah.
That's right. I'm going to play that guest number for the lottery or something, maybe.
It could be lucky. Well, it's great that you're here and great that you're part of our community. Actually, I was with a family member at one of your specialists last week, and I thought, wow, really, and I noticed there were a lot of people there, and I was surprised because, it's a specialty, and there were just dozens of people waiting to be seen, and I thought, we really are lucky in a community of our size to have Henry Ford, to have this kind of quality and level of service in our community.
Yeah, no, the whole medical group has grown, right, over the last 10, 15 years. The number of services that are offered through the hospital and then through the community obviously have expanded, and so yeah, I agree. I mean, I think it's wonderful to have that here kind of close to home and not have to go out of the community necessarily to get some of those services. So yeah, there's very few things that really aren't offered within the sort of more comprehensive physician network. So yeah, I agree. Yeah, it's great for the community.
Yeah, I was amazed, and it really struck me because 10 minutes from home to the office, and it's really unbelievable.
Yeah.
So you and Henry Ford, a big part of the Lions' success this year. That's a really cool partnership.
With the Lions.
Yeah, with the Lions.
Yeah, there's we've actually had events in Detroit where every once in a while some Lions players are there, kind of like walking around, and you get to interact with people. So I think it's fun for the staff. It's fun for people that work for the hospital, and I think people take a lot of pride. Not just the Lions, actually, the Pistons too. Although less successful on the court than I think we've been on the field this year in Detroit. But yeah, no, that's been a fun relationship for everybody. And they did a piece with Amon-Ra St. Brown. He was actually in the hospital, kind of like doing some of the jobs that people do in the hospital, and it was fun having him there and seeing that. That was in Detroit, obviously. That wasn't here in Jackson, but yeah, it's been a lot of fun for people who work there to kind of have that relationship and be able to support the team that way.
Yeah, great exposure for the health system too, as the Lions have just been dominating the NFL coverage the last few weeks.
Yep. Yeah. No. Yeah. Absolutely. Yeah. Absolutely.
So for Lions fans, we'll just wait till next year, right?
I guess at this point there's no choice. Yeah.
But in past years, we never were saying that. We were saying wait till maybe next century. But hopefully, this is a build-up to another Super Bowl run next year.
Yeah, I think these were the second playoff victories in my lifetime. So it's been a cold streak, I would say. Yeah.
Very few people have witnessed a successful Lions season. In fact, if you watched last night's game, according to those who are keeping track, the first half was the Lions' most successful half ever.
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 Yeah. I'll take it.
Yeah. Great first half. Also, I know you've been a big part of University of Michigan football. You're a big fan, and you actually, I think, were able to go to both the big finishes.
That's true. Yep, that's true. We made a trip to the Rose Bowl and then made a trip to Houston. So, yeah, something that I've been doing since I was not going to the bowl games, but going to the games since I was a medical student, and we've been able to continue doing that. So yeah, it was a lot of fun this year.
So what was the highlight of both the Rose Bowl and the National Championship games for you?
It's pretty, the Rose Bowl's pretty cool. Mm-hmm. I think that's sort of I've kind of described it to other folks that are football fans, right? It's a little more of like a religious experience than attending a football game, right? It's sort of like your pilgrimage to the Rose Bowl. So so that was really fun. That was sort of a special. I got to go with a great friend from school that So that was really a lot of fun. Yeah.
Do you have a lot of classmates that you get together with during these?
We tried to do that at the Rose Bowl, but the parking was so bad that none of us made it to the tailgate. So we made that attempt. So it was built 100 years ago. So they weren't quite as good at the in and out like we are, I think, now with professional stadiums. So yeah.
Well, good. I'm glad you had that those great experiences.
It was a good experience. Yeah, it was a lot of fun. Yeah.
Who knows again when that would happen?
That'll happen again. Yeah, it's true. Yep.
Well, here we are. We had a really cold snap a couple weeks ago, and now it seems kind of mild. So I guess it's an average winter. What kind of things are we seeing in the system this month?
So obviously it's a little bit, it's slower now from like a COVID standpoint, right? I think we're seeing less of that. Every year we have the seasonal sort of respiratory diseases that we see. And so now the big ones are COVID, flu, RSV, obviously pneumonia. If people end up with a respiratory infection that ends up getting lower into their lungs. And so it's usually right around the holidays, kind of for obvious reasons, right? People are close together and then sort of spread things. And so we see a higher level of those diseases. And if you look at kind of the CDC, how they characterize each of those things, we're either, and across the country, but here also in Michigan, we're either kind of a moderate or high activity level for any of these things, for the way that they're really like categorized now, whether it's COVID, flu, RSV. There's a lot of activity. It's just much less than we're used to coming out of a pandemic, right? So, but the hospital gets busy because there's people that have any number of other conditions, and then they get one of these respiratory illnesses and end up getting hospitalized, and that takes up beds, right? It takes up space in the hospital.
And it seems, don't hear much about it, but when you consider that we're in the fourth year of this, and the media, they move on to whatever is more exciting of the day.
I think there are more exciting things now. I think everybody's fatigued from COVID, but I think the messages are still very much the same, right? I think it's always really important to emphasize. I mean, all of these conditions now are basically, if not vaccine preventable, they're vaccine mitigated, right? So the people that are vaccinated do much, much better. Flu, COVID, RSV, all three, and pneumonia, right? I mean, the people that are over 60 should be getting pneumonia vaccines, and I think this is kind of a cultural thing in this community in Jackson that we've seen, and we just wrapped up another year here with 2023, and so we can look at some numbers and some statistics at the hospital. And we used to do 85,000 visits at the ER every year in Jackson. Now we're down to about 70,000. This is like 2018 compared to now. So that's good, actually, that we're seeing less people need to go to the ER. But if you compare us kind of nationally, we're like in kind of the lowest quintile in terms of how much people are still going to the hospital. And so that's really a function of, do folks have primary care physicians? Are they getting that sort of good preventive care? Are they getting the vaccines they should be getting? And so that's a place where I think as a community, we still actually have a lot of opportunity to improve. It's getting people in with those primary care doctors and kind of being more proactive and preventive about how we deal with a lot of these types of conditions.
Yeah, and we also have like IEP urgent care, where they're saying,
that's right.
The other morning I heard there were 90 people in a 6-hour
Yeah,
period.
it is the season for sure. But IEP has an urgent care. The Center for Family Health has an urgent care same day. There are facilities obviously within Henry Ford where we have same days at North Street and Townsend, and the Townsend one, actually we had some infrastructure issues there, so they're closed for a few months. We had some flooding at Townsend, so we've had to reorient where those primary care doctors are for the next few months.
I'm glad you mentioned that, because I saw some questions on social media wondering what's going on at Townsend.
Yep.
It's temporary.
It is temporary. Yeah, there was a not sure what I can say or not, but it was flooding basically. So they have to go in and remediate the water damage, and then I think April, I want to say 22nd is when. Maybe don't quote me, but yeah, it's But I know that it's in April when the anticipated reopening date is, and I know folks are under pressure to get all the work done as fast as possible because there's a lot of people that go to Townsend for primary care. So there's a lot of energy being focused on getting that done. The thing that's super impressive, and I think actually is worth some kudos to the team that does primary care. They were able to figure out how to basically find a new home for all these providers they have at Townsend. So the patients with those physicians can still see their physician. It'll be in a different office than they would be used to because Townsend's not open, but still provide an opportunity for those people to get in and get the care they need. So really, really amazing work that was done there.
Nice. Our drummer's doing push-ups right now. I think that's very impressive, staying in good health and shape. And
it's inspirational,
yes.
Yeah.
On COVID, I'm seeing Facebook groups, there are in-person support groups, there are, the people are meeting about it, that's such a thing, and there's so many people that are affected by it. What do we know more? Anything more?
Yeah, so long COVID or post-acute sequela of COVID is the medical name, but it's there's a lot of theories about what is happening, and I think that it's kind of, that name is kind of a common name for like an umbrella of symptoms that people have after they've had the acute phase of the illness, so there's a variety of kind of hypotheses for what is happening, but the most common symptom is usually just fatigue. People just don't feel like they have their energy back, and it can take a long time, months for them to recover actually. And estimates are somewhere, there's been various publications, but probably the most accurate is somewhere around 10% of cases of COVID end up with symptoms that last longer than a month, longer than 4 weeks, and then they fall into this long COVID category. But fatigue is really the most common one. And there's various other symptoms that people can have. I mean, in the very beginning, people would lose their smell, right? And that could take 6 months to a year actually to improve.
Wow.
And so that would actually still fall under this umbrella of long COVID. It's a symptom that's lasted now for longer than a month. The best treatment for long COVID is to not get COVID.
Yes.
And actually, if you compare people that have had COVID, who are vaccinated, against people that have had COVID and not vaccinated, the people who are vaccinated get long COVID at rates that are significantly lower. So about a third as many people who have been vaccinated get long COVID compared to people that are unvaccinated getting long COVID. So the vaccine is protective, actually, not only against getting the disease, but against getting longer-term sequelae or longer-term symptoms after the disease is over.
You're right. Another reason to avoid COVID and get vaccinated.
Yeah.
Well, thanks for being on our anniversary show again.
My pleasure. This is fun. Yeah.
Our guest number 36,837 in our 23 years of our show. VP of Population Health at Henry Ford Jackson Hospital, Dr. Courtland Keteyian.